All right. So welcome, Dr. Laura Stark.
Thanks.
So you are a cancer naturopath, and you're the president of the Saskatchewan Association of Naturopathic Doctors,
I am indeed.
and you're the cancer care program director at the Clear Health Inn, which is a alternative cancer care clinic. Right.
In short order, yes.
Okay, yeah. So can you tell me about what is naturopathic medicine? I'm sure a lot of people know what it is, and some have an idea, but they don't quite know what it is, and some people are not quite sure.
It's true. I think there's a lot of perception that naturopathic medicine is kind of a little bit of a quackery and or it's medical voodoo in a way. But really, we are trained as primary care physicians that approach the medical problem a little bit differently. So the model's a little bit different. We look at health in a really holistic sense. So that's one kind of main aspect to being a naturopath. So we look at the person as a whole, not just physical individual systems in the body, but looking on all those subtler layers from the physical to mental, emotional, spiritual even, recognizing that the things that influence a person's health go far beyond, say, a chemical imbalance in the body. So when we look to evaluate someone's health, we're really looking deeply and broadly for all the factors that can influence a person's health.
So can you give me an example? So for example, if somebody comes in with a blood pressure problem in the doctor's world, we know how to measure it. We know what drugs there are, chemicals that will lower it. We can measure that too. And there's trials to say that this is effective and these are the side effects. And that's kind of what we go by. So you come with that problem, we know what the fix is. Somebody comes in and I'm a surgeon and they come for an appendix, we know what they get, what medication, surgery, this, that. So if somebody comes in with those problems or different problems, how does your approach then differ? How does it work?
Indeed. So the conventional model really is find the diagnosis and then institute treatment protocol. Versus naturopathically, we take a step a little further back. I don't really care so much about what a diagnosis label is. I'm really interested in what is going on in that person's physiology. So I'm asking those deeper questions of why is this problem? Why is this symptom here? Why is this problem manifest? And what do I need to do in a person's physiology to correct it? So a functional medicine approach, people understand that that's what they do, and naturopaths were kind of the original functional medicine doctors before they got fancy and created their own functional medicine protocols to systematize it. But we're asking those physiological questions. So hypertension, high blood pressure could be related to stress, right? We're looking at a person who has this fluctuating high systolic numbers, the top number in blood pressure. They're probably a little bit adrenal unstable. They might need some adaptogenic herbs to help them adapt to the stressors in their life with more resilience. A different situation, we might see a blood pressure that is kind of always elevated and the diastolic number is quite high. That's usually related back to liver function. And we find those cases more drug resistant as well. And it's because usually the drugs challenge the liver a little bit further, and it's not actually correcting the physiology that is actually at the root of the problem. So we're about digging to figure out the physiological root of what is really going on and trying to solve that.
Yeah, maybe I oversimplified the medicine approach a little bit because also in medicine is like a broad differential for
absolutely
for even
what is going on.
Exactly, for blood pressure. So usually like a good traditional medical exam would be, a full history and physical exam, and sometimes it is a lot of times it is stress or exacerbated by stress. Sometimes it's the adrenal tumors. Sometimes the treatment is surgery, believe it or not.
Yes, true.
So that's kind of the same approach that traditional or mainstream medicine would take, Western medicine.
A little bit. I think there is a difference though, and it's quite nuanced. I think conventionally there really is kind of these definitive answers that then roll out a treatment protocol versus in the naturopathic approach, it's far more open to subtlety and nuance, and we don't need kind of even definable diagnostic criteria. For example, even in the interpretation of lab work, often in the medical world, there isn't a diagnosis until you cross over a certain threshold, a certain line. And naturopathically, we look for those patterns, and we can treat them a lot earlier in the disease progression. So often people will come with symptoms that aren't diagnosable yet, but we can still dig into that root, whereas the medical world won't find that problem. And that tends to be the selection bias of the people who come to naturopaths and we serve best, because they don't find the answers in the medical world.
So is it fair to say then that maybe you're not as much driven by diagnoses and thresholds? Is that correct?
Especially me personally.
Okay. Because
I think
you're
generally
right
as well that, we don't care as much about diagnoses. And a naturopathic diagnosis could be something like, we might take a Chinese medicine lens and diagnose liver qi stagnation. And that's my high blood pressure diagnosis. And so I'm not directly treating high blood pressure at all. I'm just treating liver energy in the body.
Okay. Now, so the other question is, how do you arrive at that? Because I would tell you that a doctor to diagnose a liver problem, would need history, physical examination signs, blood work to corroborate what's going on, maybe even some imaging like an ultrasound or a CT or an MRI.
Indeed.
So, but you would arrive at a diagnosis for liver. How would you make that?
We would use all the same information gathering procedures. I think our view is a little bit different, probably. But naturopaths are really good history takers as well, and pattern recognizers. So we do get trained in traditional medicine paradigms like Chinese medicine or Ayurvedic medicine that were developed before the time in history where we actually looked inside bodies, right? A lot of the principles of Chinese medicine were founded before a body was even opened up. We didn't know what the organs looked like even.
So can you tell me about Chinese medicine? Like, what is the main premise of that? So we hear a lot about it. We know there's herbs. We know
there's herbs, there's acupuncture.
Yeah, but in my mind, herbs would be their version of medications, because either chemical medications are derived from herbs and plants.
Indeed.
But do they have a different philosophy or an approach, or what's that?
Yeah. So I'll group Chinese medicine and Ayurvedic because they're very similar.
Ayurvedic comes from India?
Yes, it was the precursor to Chinese medicine. Chinese medicine evolved out of Ayurvedic. Basically, in essence, it's all about balancing the elements. So every aspect of our body and every aspect of our environment can be described in terms of the elements. In Chinese medicine, they describe 5. In Ayurvedic medicine, they describe 6. More of our Western philosophy, we have 4 elements, right? But it doesn't really matter, the different systems. So we have a balance, or there is a certain balance of the different levels of the elements, which in Chinese medicine are water, air, earth, fire, and wood.
Sounds like the last airbender.
Right, it is.
Yeah.
That's exactly. It's precisely the same.
Yeah.
So each of those elements have their characteristics. So, and when they're out of balance, we'll see different symptoms based on that.
So those elements, is that in each organ has aspect?
Each organ, in each human, we're each born with a certain constitution. That is our certain balance of elements.
Or does each element in a human involve certain organs?
Both.
Like water would be kidney, something else.
Correct. They have their organ associations, but there's kind of a constitutional look at it. I'm supposedly a water constitution.
So who decides that? Like, how do you know that? Who told you that?
A Chinese medicine practitioner.
And how would he?
I'm honestly not an expert. Chinese medicine is not my forte,
But he would have criteria to tell you that?
Absolutely.
Okay.
Interestingly, I learned a lot taking a baby massage, a Chinese medicine-based baby massage, and you can apparently tell babies apart by their different types of cry. You can see it manifest in people's personality. We describe people like having a fiery personality, or someone being really earthy, right? They're grounded, they're more heavy.
I wonder if someone can change over time.
Absolutely. Well, there's arguments there. So we're supposedly born with our certain constitution. We can certainly manifest different levels of imbalance, right? And that's when we would become symptomatic. Whether you can really change your constitution, kind of your natural set point. Supposedly, if you do enough kind of hard work, immediately a woman can change her constitution after giving birth to a baby in that kind of critical time where our body's like ripped open from maybe a Kundalini perspective or something like that. The channels are wide open after giving birth. You can exert enough influence on the system that you might be able to shift a constitution, but that's the only instance I've ever heard of.
Well, what I'm thinking of mostly was, let's say, you know how you hear somebody would say, "Oh, I was much softer in my younger years, and I was naive, but then they learned and they went through a lot of experiences in life, and now they're more tough, and they're, you know."
Yes, actually, so I've not heard of this in a Chinese medicine paradigm, but shifting to another paradigm, the world of homeopathy and constitutional homeopathy. Especially a system, I'm going to get the person's name wrong, but there's a particular system that was popularized or kind of created by, I'm not going to even remember exactly what country he's from, but anyway, had a little bit of training in this system that treats these various levels of our being with homeopathy, a miasmatic level, a constitutional level, and a temperamental level. And traumas are a thing where significant life experiences can shift a homeopathic constitution. I've seen that happen to my husband, actually.
So you think in Chinese medicine the same thing can happen? Like over time somebody can shift from a water to a fiery personality predominantly?
Maybe.
Yeah. Certainly
I've seen these examples in that homeopathy world. And my husband's example, in his 20s, he became severely ill with ulcerative colitis. And prior to that, he was like pretty stocky, earthy, heavier guy, thick, dark hair. And through his illness, which lasted almost a decade, a lot of time spent in hospital, a lot of steroids, a lot of like harsh drugs, like he lost most of his hair, it changed color, it's a lot thinner. And he's far thinner. He's a different build now than he was in his earlier years.
Maybe that can explain some of what happened to me.
These shifts happen.
Yeah. So you were talking about Chinese medicine, right? Is that incorporated into naturopathic medicine, into mainstream naturopathic medicine, or like do you use part of that in what you do, or because there are specialists who do just Chinese medicine, right?
Yes, correct. Yeah, so naturopathic doctors are kind of generalists of the natural health world. So Chinese medicine was adopted into most of the naturopathic schools in the 80s. It wasn't a part of it before, and there's still some schools in the United States that don't teach Chinese medicine as part of their curriculums. So those naturopaths who graduate do not have that skill set. But most schools, since the 80s, teach a core of Chinese medicine, of homeopathy, of chiropractic and massage, nutritional medicine, traditional Western herbal medicine, as well as, so since the 80s, all of our conventional or naturopathic schools include basic Chinese medicine, Western herbal medicine, nutritional, so meaning both dietary and supplemental nutritional approaches, chiropractic and massage therapy, more traditional hydrotherapy and physical medicine approaches like physio-like assessments, and I didn't mention homeopathy. Those are the core modalities that naturopaths are trained in broadly.
Okay, so there's no like small niche of this is naturopathic medicine principles like that's outside of all of that. It's just all of these come together and then they form the universe of what naturopathic medicine is.
Well, I guess those are the examples of our modalities, we call them, are just our treatment tools.
Okay.
There is a core philosophy that defines what naturopathic medicine is.
That uses these tools.
Exactly.
So tell me about that core philosophy.
Tools. Oh no, I'm not going to be able to quote all my naturopathic principles. Most are derived.
Just
from
an idea. Yeah.
Most of them are derived from the Hippocratic Oath,
Okay.
just like medical doctors. First, do no harm. That's one. Primum non. I'll probably be able to remember them in Latin. Primum non nocere. Not that I can pronounce Latin. Preventative medicine is one of the principles. A doctor is teacher is one of the principles. That we educate our patients on how to maintain wellness. Treat the individual is one of the core principles. So meaning we have individualized treatment plans. We treat each patient separately. There's no such thing as just a treatment protocol that this is how we treat this condition. It's all individual to the patient. The most core one is called the Vis Medicatrix Naturae, the healing power of nature. That's the most important and core one to me. And a lot of people will describe it differently. Some of the healing power of nature, and they're like, oh, well, like herbs are healing in the most rudimentary sense. I think that's a little bit too kindergarten to explain what it is we do. To me, the healing power of nature, the Vis Medicatrix, speaks to the fact that there is a vital force in our body that is kind of the directing force to life and to healing. And truly, that's what a naturopath is working with. No matter what the tool, they should be looking at the body, looking at the body's vital force, assessing that, and figuring out how to address the issues with the vital force in any given person. So that gets to juicy stuff in our philosophy.
Yeah, I mean, the question is, how do you do that exactly?
Yeah, well, and it points out some differences in different naturopathic approaches. So in school, we make fun of the green allopaths, we call them, who will use naturopathic tools, but without recognizing that there's a vital force in a person. So they're just applying herbs. They're just, giving supplements. And so they look like a naturopath, but here's one of the big arguments against most functional medicine doctors. They'll do this nice little assessment and find all these different imbalances in the body, and they'll give you a supplement for every single one. You'll wind up with a prescription that's 72 supplements long.
Okay.
The body can't go in 72 directions. We understand as naturopaths there's a therapeutic order, we call it, and there's kind of a hierarchy. Understanding the root cause of an issue, kind of understanding the structure of how physiology works. There's superficial problems or symptoms, and there's deeper layers to it. So different remedies will apply in those different layers. For me, our goal should always be working to the root layer, because if we work there, we'll have the ripple effect through all the rest. Versus you can work on just palliating a superficial symptom, right? You can take the Tylenol to get rid of the fever, but there was a purpose to that symptom. And if we can honor that purpose, looking back down to the physiology and supporting that, a good old classic naturopath might apply some hydrotherapy to actually encourage that fever to do its work to help kill the bug and move expectoration out of the body to get the person well again, rather than just take the symptom away, which is going to prolong the illness.
So is it fair to assume that there's no standard set of tools that a naturopath would use to distill a problem down to its core and to actually apply treatments?
Correct.
So the practice of different naturopaths will vary way more amongst themselves than the practice of doctors amongst themselves.
It's true. And even how long ago you were trained or who you were trained by. Most of my contemporaries, right? I've not been out of school quite a decade, almost a decade already, but modern naturopaths are not as learned in understanding that deeper, that subtler physiology.
What's the reason for that? Are they trained differently now, or?
There's a lot more push towards being more allopathic and being more acceptable to allopathic medicine to gain recognition. And
so allopathic, just to be clear,
yes,
is traditional Western medicine.
Correct.
Right?
Conventional medicine.
So those green allopaths that you said that
yes,
are over 72, what are those?
often like functional medicine practitioners.
Okay, so it's still an alternative health practitioner, right?
They can be
like a herbologist or whatever they would call it.
Functional medicine practitioners are often MDs who've taken a functional medicine course, and that gives them basically a structured assessment tool. They usually use some sort of questionnaire or some interesting
so those would be family physicians who take on
extra integrative training.
Does that happen in Canada too? I know
it's primarily in the US, but there's certainly functional medicine practitioners here as well. Or often chiropractors will then get functional medicine training, which allows them greater scope in the world of supplements.
Okay. So your view on that would be that they are using some tools that you'd use, but they're not applying the whole philosophy. Is that right?
I've not seen an awesome functional medicine doctor yet.
Okay.
They're more frustrating than not.
You think they're missing some elements of how they're going about this?
They don't have the philosophy.
They're not distilling it down to the cause, right? Okay.
Precisely. Sometimes they magically have the little test that unlocks the secret of, oh, is this key nutrient that a person was missing? And that's when they perform miracles. But I've more often seen than not these prescriptions of 30 to 70 supplements and a person's body just completely overwhelmed by them. They're not making progress in a direction.
Yeah. So are you aware of any healthcare systems, probably outside of North America, where naturopathic medicine or some form of alternative medicine is kind of integrated with traditional medicine? And how does that work?
Far more common in Europe, and I don't have a deep understanding because I've not been there to experience it personally, but I know in countries like Austria and Germany, in the oncology world in particular, a lot of what we would consider alternative or integrated practices here are prescribed right by your conventional oncologist in those countries. So mistletoe is a great example of that. Well accepted and well researched there, really fringe here. You can't even get it in the US with any sort of ease. We can get it in Canada, but there it's prescribed alongside your chemo and radiation 70 to 80% of the time.
Now, is there some advantage to that being the case rather than having these two systems separately as they are here?
Well, certainly for ease of the patient, right? Here, people have to have major education and major advocacy for themselves to be able to access the full spectrum of support. And their oncology team has no knowledge, and even sometimes over-the-top ignorance that they put up the blinders and are not willing to look, and or therefore just give patients the recommendation that like absolutely not, that's harmful, even though they have no knowledge of it. They just say we don't know and therefore it's bad and stay away from it because we don't know what it will do. Versus if you had a full team where everyone could support the patient, recognizing that they had different areas to contribute, that would always be better.
So then the patients here, if they come to a naturopathic doctor, it means they're pretty much going against the grain of what they're supposed to be, what they think they're supposed to be doing. Right?
Often.
And so that means, does that select for a specific type of patient then that seeks this out? Some that are more independent or have reached a dead end with the traditional medical system or frustrated with it or unhappy with it.
Yeah.
Or some that just don't believe in it at all and just want to do something totally different.
Exactly. The trends I see are either people who have kind of been through the system and are dismayed. They've had bad experiences, which then motivate them to look elsewhere and say, like, there's got to be something better than this, or I have to be able to get better care. And so start seeking for themselves. But then right off, the people who get to us earlier, those people have they come to us at later stage. They've already been through the ringer and have suffered some damages and, are having a rough time. But there's another category of person who, right from the get-go, right from the moment of diagnosis, go, this can't be it. This doesn't make good sense. Why? They have this inner feeling that, no, there must be a reason this is going on. There has to be more answers than I just need chemo, and it just doesn't make sense to them. Well, I imagine those are my favorite type of people to work with.
I mean, I imagine the biggest motivation would be if they don't like the answer they're getting from the doctor. Meaning that they don't like the survival odds that they're given. They don't like the side effect profile that they're given, that it might be prohibitive.
Yep.
It might be that, and the oncologists are trained to be frank, and they, which is a good thing.
Yeah.
So they'll tell them, this is, pretty much a dead end. We can't do anything for you, and this is just how it is.
Yeah, exactly.
So, but then that's selecting for a certain type of patient that's coming to you, rather than somebody who's at earlier stages of things.
Yeah, absolutely. I think there's a good corollary of resilience that comes with that personality who responds that way. Gets told the message and doesn't accept it. Right? There's the person who goes like, "Oh damn," and they just move into victimhood. Those are the people who give up right then and there, and the stats will apply to them. They just accept them.
Yeah.
Versus the person who goes, "No, that's not good enough for me." They have this little bit of fire. They're not willing to just roll over and die and accept the status quo. They have motivation to help themselves, and that characteristic goes a long way to change their stats.
Now, the view from the oncologist would be that, hey, we're giving them information based on stats, large studies, proven science.
Mm-hmm.
You might be giving them just hope based on no evidence whatsoever. Mm-hmm. And isn't that, like, in their mind, that's unethical? Really?
Right.
And that situation is unethical, right? Because you're giving them hope and you're charging them money, and you have nothing to back up what you're saying, really. They have large studies mm-hmm. with, that are with scientific methodologies, right? So how do you respond to that?
Well, again, we're working in different paradigms. So I recognize that stats can't apply to an individual. A statistic applies to a category of people. So you get placed in a category, and there's, a sample chunk. And that sample will have a certain average survival. When I look at an individual, and I only look at individuals, I don't care what your diagnosis is. Sure, you have breast cancer. Sure, you have whatever cancer. I don't care. I want to know what the condition of your body is. And you will fall somewhere on this bell curve of survival. And my job is to put you over here on the bell curve, on the 95th percentile. And not on, the 5th percentile over here. Find influence their place on that bell curve towards that 95th percentile, where they're the ones breaking all the odds. Versus standard of care is designed to put people in the average and treat them as average. But when we can influence all those individual characteristics that we know can shift the needle, that are safe, when we can have say combination safety data that we know we can safely combine things with standard of care, chemotherapy or radiation treatments, we often do have that data. We don't have massive double-blind placebo-controlled trials on each of our different therapies, but our model of care is different. It's a complex system, and even the methodology to study that needs to be completely different. A double-blind placebo-controlled study doesn't work for naturopathic medicine.
So what kind of study is the most typical study that would be out there for naturopathic doctors?
Well, it depends. Probably the most appropriate model for assessing naturopathic care is kind of like case control studies, where you do case by case in a way, and you do case series where you can look at the complexity and all the different factors at play. That's the most appropriate descriptive method of it. But there are different study designs where you can look at kind of smaller chunks of a treatment plan.
Case series or, yeah.
But they can do kind of smaller chunks, or we clearly have the ability, and there is plenty of research for individual interventions, nutritional interventions, right? And we look at the layers, say when we're evaluating whether a therapy can be supportive to chemotherapy. Usually there's Petri dish studies to confirm, well, just on a cellular level, what mechanism of action might be. But then we're looking for in vitro studies as well to confirm clinical safety, because sometimes we can understand the mechanism that might make sense in a Petri dish, but the complexity of using that intervention in a human body is far different. So we look for those higher level trials. For example, any therapy we combine with chemotherapy or radiation, we're looking for human trials to confirm that safety. And usually we then have this history of historical knowledge of kind of safe clinical use for hundreds of years in naturopathic medicine, where we understand what it does to physiology. We have the safety confirmation, and or sometimes we have the benefit of at least some level of evidence that shows improved outcomes. And then we're working on an individual basis just to shift the needle. To me, that's just compassionate, that's no nonsense. Why wouldn't we do that? When the best case scenario is not cure in conventional medicine, when that isn't even an option, why wouldn't we give it our all on an individual basis when we can assume we can demonstrate safety?
So that's what I was going to say is, in my mind, and correct me if I'm wrong, but I think the advantage to having them a bit more integrated as the model in Europe, as you said, is that then the people administering the traditional medical methods know something about these other methods, and then they're integrating them with the treatments they're prescribing so that it doesn't affect, like it doesn't contradict whatever they're trying to do.
Precisely.
Rather than two different systems going on and they don't talk to each other.
It's true.
So the timing of when they get the treatments, everything is kind of in sync with them.
Yeah. And right now that's just the naturopath's job, right? Because we have that understanding. We have the understanding and the training of what conventional world is doing. Unfortunately, the education doesn't go the other way around.
So back to the scientific evidence part. So now the push in medicine has been for a few years is to go more with, the buzzword is individualized or personalized treatments. Right, which is a step in the right direction. But
absolutely.
If you read the editorials in the New England Journal of Medicine, they're all talking about that now. So, and this is especially the case in oncology. They're trying to come up with each person's tumor profile is different. Not all, even if you have the same exact type of colon or breast cancer, and this person is a bit different than that person. The receptors are different, the treatment targets are different, everything's different, so it's individualized. We're not there yet, but that's where it's going. But one would argue from that point of view that the studies and the statistics that you said don't necessarily apply to everyone, but that the best scientific way we have of objectively standardizing and saying what can work and what doesn't. Otherwise, we're going by just like no evidence per se, just hope in a way. Or evidence that, hey, it works in that person, but who knows? You didn't control for 10 or 15 different factors.
Yeah.
How do you know it's going to apply to this person now?
Yeah.
Without the proper, scientific method, right?
Correct.
So how do you address that concern?
Radically different paradigms. I don't know. I kind of feel like, well, to be honest, where my mind was going as you were talking there, that the individualized approach of conventional oncology, I think, is barking up the wrong tree a little bit. The focus on genetics, for example, like that's one of the methods. Sometimes they're just looking at various receptors, right? There's finding targeted therapies that work intracellularly and do their job. I think those are the safest medicines we have because they truly are targeted versus like immunotherapy approaches.
Well, that's what the personalized therapies, the idea behind there isn't that it's just personalized. The idea is that it's so specific that it hopefully
only targets that
targets
cell.
Yes, rather than have like a scorched earth approach and targets every other organ.
Precisely.
Which is,
which is why when I see a patient who does qualify for a targeted therapy right now, I just go like, yes, do it, because they're the safest drugs we have. We see people tolerate them. There just isn't that many. But they're like the small molecule targeted therapies. They work intracellularly, so there isn't the broad acting, like devastating effects. Immunotherapy sounds really kind of romantic and promising because they're like, oh, it just helps my immune system fight the cancer. That is not what immunotherapies do. They lock onto a certain immune system related receptor and change its function throughout the entire system, and immunotherapies unfortunately usually cause, so from the statistics I've seen, generally have roughly double the side effect profile of conventional chemotherapies, except those side effects aren't just temporary toxicity side effects like chemo side effects are. They are like irreversible, causing irreversible autoimmune disease, for example, wiping out someone's ability to produce cortisol, wiping out someone's thyroid, causing autoimmune pancreatitis, like severe life-threatening conditions. They're pretty devastating drugs.
Mm-hmm.
I don't think that's a wise avenue to bark up.
Yeah, I think.
But then genetic targeting is interesting and weird, but I don't think the science is there
yet. Yeah. I know like some progress has been made with biological therapies, which they target specific receptors that are expressed on the tumors that shouldn't be expressed elsewhere. But that's still in the research phase, I think. It's been that way for the last 10 years or more.
Well, and as many of the immunotherapies.
Yeah, but they try to do the same thing.
They're considered those biological medicines. Interesting.
Yeah.
Yeah.
All right. So if somebody has cancer, at what stage do you think they should be seeking, advice or medical help outside of the medical system? And I mean, from the medical system's point of view, that's considered dangerous, to be honest.
Mm-hmm.
From the patient's point of view, I think the trend is more and more of that because they do a lot of research and they look.
Yeah.
Although now with changes in Google algorithm and there were an alternative help, maybe that will just go back to they won't find that information anymore. But that's just a side note. But at what point would you say? Because what makes sense logically to me is if the oncologists tell you it's it's a closed road and there's nothing else that we could do. You're on your own. You're gonna die. Then you have nothing to lose, right?
Absolutely.
That's fine. The contention is when there is something potentially curative, like surgery, like if it's a cancer at an early stage.
Yeah. And
the patient elects to instead go for other treatments, naturopathic treatments, or any alternative health treatments, and doesn't forego this. So they can either just do medical approaches alone, health approaches, alternative health alone, or do both.
Mm-hmm.
Like, what would your take be on this, and when? Because right now, as you said, it's kind of like the patient will have to make that decision on their own. The doctor isn't going to tell them that.
Yeah.
So if they're going to consider that path, what would you tell them? When should they come to you?
For me, the answer is always now, yesterday, because our alternative naturopathic approaches always work best in the mildest of situations. Right? We have the greatest chance of making the greatest good when we have the smallest problem to deal with. Right? The magnitude of effectiveness of even like our anti-cancer tools are maybe half as effective as, say, a chemotherapy. Right? A good chemotherapy drug will have a tumor kill-off rate over 80%. The best of the best naturopathic approach that is an anti-tumor approach like that will have maybe 40%. And so we rely on synergy and combined approaches a lot to get greater magnitude of effect.
So you have anti-cancer tools. Yeah, so we were back at you have in naturopathic medicine anti-cancer tools that alternative medicine does not have. Is that right?
You mean conventional medicine does not have?
Correct.
Yeah.
So can you give me examples of that? Because I know in conventional medicine there's surgery, there's radiation, there's chemotherapy, and then there's the neurobiological things.
Yeah.
So what would you have that are anti-cancer tools?
So mistletoe would be one of them that I mentioned earlier, commonplace in Europe. It has, interestingly, there's a lot of, almost every herb, every plant has anti-cancer properties. And the question becomes like dose and delivery of the magnitude of effect we can get. But like in a petri dish study, put cancerous cells in almost any plant on the planet, that plant will kill the cancer cells in a petri dish. So that's really cool. And it tells us something about nutrition and filling our bodies with a variety of plants as medicines. But we're talking about our bigger anti-cancer tools that have actually have some established reputation. Probably the biggest, most popular, well-known one is high-dose vitamin C therapy, right, popularized through the Reardon Clinic, and naturopaths have been doing nutritional IV therapies and high-dose vitamin C for a lot of decades. Linus Pauling and his research around mega-dosing vitamins also helped pioneer that approach. It has a neat mechanism, not fully understood, which most of our things don't have fully understood mechanisms, even in the conventional world, but at least part of the mechanism for vitamin C is molecularly, vitamin C and glucose, almost identical in terms of their molecular structure. They have like one bond different that differentiates them. A metabolically hungry cancer cell gobbles up that vitamin C thinking it's glucose, whereas a healthy cell knows what to do with vitamin C. Takes it in, fills up their antioxidant stores, gets rid of the rest, and we pee it out. A cancerous cell loses some of that mechanism, and it actually will turn that vitamin C into peroxide, poison themselves from the inside out. So intracellularly, the vitamin C gets turned into peroxide.
So would it be fair to say then all of these tools that are anti-cancer tools really fall under the category of herbal therapies? Ultimately?
Probably not necessarily.
Because you're talking about mistletoe, you're talking about other herbal, you're talking about plants, right?
Yeah.
Is that...
Well, vitamin C is straight up ascorbic acid, so that's just a straight nutritional.
That's different, yeah.
And sometimes, honestly, they're kind of middle of the road synthetic things. So here's another herbal example, wormwood herb. It can be used in a lot of different forms, but its IV form is called artesunate. It creates peroxide poisoning in cancer cells, similar to vitamin C, except through interaction with the iron that cancer cells often sequester. It's a good booster treatment to vitamin C, so those are often synergized together. But here's a bigger oddball example. DCA, dichloroacetate, is basically a vinegar extract, and it's the closest thing we have to a natural chemo. It is a great kind of targeted therapy for neurological stuff. It's often my first line recommendation for brain tumors because of that. And it will actually cause peripheral neuropathy like chemo often does. But wonderfully, it's reversible, and there's just certain nutritionals that will protect the nerves that if we take nutritional support along with DCA, we won't see that side effect. Dmso is another weird one. It is a byproduct of the paper milling process, a solvent, and it's used in conventional medicine, dimethyl oxide. It's used in transdermal medications. So anything you combine with Dmso, it will basically carry it intracellularly. So hence it's used for transdermal medications because it will take things into the body. Intravenously, it's been studied in combo with high dose, well, not terribly high dose, but decent dose of sodium bicarbonate, baking soda. Interestingly, the study did not really look at the bicarb. They were just balancing the bag's osmolarity and thinking of Dmso as the only active ingredient.
Yeah, this is all IV.
Yes, these are all intravenous examples so far, except artesunate or artemisinin can be taken orally as well. Just different ability to achieve therapeutic dosage. Dmso and or bicarb. We had a patient inquire the other day about the Simoncini protocol. A doctor out of Italy, Dr. Simoncini, describes cancer. He thinks cancer is a fungus, and sodium bicarb is the best antifungal we have in the world, says he. And he treats cancer with high-dose bicarbonate, IVs or cathetered turmeric.
But is bicarbonate an antifungal though?
I don't think so.
Okay, because if that's the case, I'm just wondering, because there are a lot of systemic fungal infections. Like in the ICU, we see them a lot, and people are immunosuppressed.
Absolutely.
The fungus tends to go haywire. But there are specific antifungal agents for that.
Yep.
I mean, if he thinks cancer is a fungus, could those work against it, or?
There are interesting practitioners through the years who do treat cancer as a parasite or a fungus. and they will use a high-dose antiparasitic, antifungal, antibacterial, antiviral herbs, and or interesting bug zappers. There's practices like the Hulda Clark kind of parasite cleanse thing, and she has some sort of electronic zapper that also happens, so you match the frequency of whatever bug and supposedly kill it with these frequencies applied to the body. I think it's interesting. I don't discount sometimes the effectiveness, but I think the premise is wrong. I don't think that cancer is a bug. I think bugs can be associated with cancer, and I believe their role is often actually in cleaning up tumor and helping the body heal. That is the purpose of bugs and infection in the body for me. They clean up tissue that should no longer be there. And so we often see them associated, but I don't think it's a cause and effect like most people think. The bugs are not the enemy.
Well, I mean, from my understanding of what cancer is, it's the cell's own ability to replicate and make more of itself, which we need. Like when you break your skin, you need more skin cells, right? But when the checks and stops on that are no longer working, then it just keeps replicating, keeps growing. And that's what cancer is. So what I always thought is that anything that kind of damages the cell's genetic material in a way that you don't have those checks and stops anymore, and that could be inflammation, it could be trauma, it could be an infection. There are cancers that are known to arise in areas of chronic burns. So I always thought that the bugs, that's how they figured, is when you have an infection and an inflammatory reaction, and then it's sort of the byproduct damage of that is what happens to the cells. Would you agree with that?
There's logic, but I don't agree.
You don't agree? So what's your take on it? So what is your take on it?
So I don't believe that cancer is a genetic flaw or a mistake in any way. I don't believe that nature falls into chaos. I don't see any example of it in the world, ever. It's not one of our fundamental laws of nature. One of our fundamental laws of nature is that life perpetuates, life recycles, and this harkens back to that healing power of nature. That is the primary force directing life on this planet, and its direction is towards healing. I don't believe there is a destructive, chaotic force that does the opposite.
Yeah, we're talking about a system that works fine, the body. It's all in homeostasis.
Yeah.
But for whatever reason, the checks and stops in one, it just can be one cell.
Yeah.
That goes haywire, and then that's how. So it's not. You can have genetic factors that make you more predisposed for that to happen in one organ rather than the other. That's why we see inherited, breast cancer and other things. But what I'm saying is, it's like a local, it's like a car accident. It just happened to happen in that one place in that one cell for whatever reason.
I think there's always a reason, and it's not just whatever reason. I think there is a reason, and
yes, like we said,
address that.
Yeah.
And I think it happens for a reason. There is a biological purpose to cancer. Our body is doing it on purpose to help us. I don't think it's a problem. Can you elaborate on that a little bit? Yeah. So these ideas come from a paradigm called German medicine. And I may as well start from the start. The best way to kind of encapsulate it, explain it, is its origin story. Dr. Halmer was an oncologist in Germany, working in the University Hospital of Munich, and he had the experience of his son being shot and killed. He, following this, developed testicular cancer.
When was this?
1978, I want to say. Okay. His son was killed. So, very recent history. German medicine is not an old paradigm.
And this was in Germany?
Germany.
Okay. Don't all great inventions come from there?
Right?
Yeah.
It is the birthplace of modern naturopathic medicine.
Of human ingenuity medicine. Modern history, anyway. Not the not all of Earth's history, but modern history. Yeah.
So Dr. Hummer, being a man of science and a very intelligent man anyway, but being an oncologist, he thought to himself, like, I was a robustly healthy man. Clearly the only thing that happened to me that, you know, when he does his gut check, like, clearly this trauma is what caused my disease. But being a man of science and an oncologist, he couldn't just accept that idea because he was taught very different things. So he thought to himself, well, okay, if I experience a trauma, you know, in my mind, and it somehow translates into disease in my body, well, I should look at the brain. So he, you know, happened to have a bunch of oncology patients. He started looking at all their brain CT scans. And lo and behold, he found these lesions. They'd been seen before on CT scans, always written off as artifacts of the machine. They were these perfect little round target bullseye looking things. And they were written off as artifacts because that was clearly not something in the brain. That was a reflection from the machine, whatever. But he noticed, as a random example, he had like 5 right-sided breast cancer patients, and they all had this reflection on the same place in their CT scan on their brain. And he thought, that can't be coincidence. So went back to Siemens, the CT scan company, and asked for finer slices, right? Take a higher resolution look at the brain.
Did they repeat the CT scans? Okay.
Yeah. And lo and behold, they were still there, and they could demonstrate they were actually 3-dimensional. They were not a reflection from the machine. They were reproducible lesions on the brain in specific locations. And so he found this correlate.
So they were real.
They were real. And he found this correlate between a patient's diagnosis and the location in the brain where this target lesion showed up. And then further to that, he explored their histories, and he found these themes of trauma appearing. And so that's Dr. Hummer's genius. It became the work of the rest of his life to kind of correlate these 3 pieces that always go together: the location in the brain, the organ in the body controlled by that location in the brain, and the kind of psychological trauma that would impact that part of the brain. So what he came up with in exploring case after case after case were basically pretty primitive survival themed sort of stressors. And he mapped the brain based on the embryological tissues of origin. So he was able to describe in detail kind of the 3 levels of the brain, which he's color-coded nicely in his works. But the cortex, medullary brain, and brainstem and cerebellum, each correspond to various tissues in the body that respond differently. We can kind of see a development of the different layers of trauma versus the cortex of the brain is our more modern
So
brain.
right now you're talking about describing a physical trauma to the brain, and depending on which area in the brain that is, that's going to predict where in the body you'll have cancer.
Is affected.
So this isn't about the mind per se, right?
It is actually. So the thing that impacts that physical trauma on the brain that we can see on CT scan is a mental emotional trauma, a shock. He called it the Dirk-Halmer syndrome, named it after his son.
But what's the relation between that trauma and shock versus the physical brain injury itself?
It's a direct relationship, and it's how the shock is perceived. So there's different kind of themes, if you will, that will affect a different location in the brain and a specific tissue. So for an example, skin is affected by what we call a separation conflict. And interestingly, the connections are often easily understood through metaphor. They make biological sense. And the tissue that responds based on the trauma is actually trying to solve the problem of the trauma.
Okay, but what I was getting at was, so his primary theory was that a mind pattern or a psychological trauma is what's causing the cancer.
Correct.
It's not about the physical injury to the brain, right? The physical injury to the brain here was just a surrogate for him to prove.
Precisely.
Right?
That was the mechanism that it got there.
So ultimately now his theory is what type of psychological trauma will determine what type of cancer.
Precisely. In practice, we
usually
don't have to talk. We don't have to look at the brain.
Okay, because you may not even have that, right? Do you have to have a physical brain injury that you could see with a psychological trauma when there's no physical injury?
It will always be there, but it's of usual inconsequence.
So you're saying that a psychological trauma will always cause a physical injury to your brain that we could see on a radiological study that we could prove?
Yes, if it is a shock. So if we have a stressor that we consciously process and we deal with it, this does not affect the brain. It does not cause disease in the body. But if it is an unexpected shock that in the moment we can't handle, our body basically takes that on for us. So we will have a biological response to deal with the stress rather than dealing with it on that mental, emotional level.
This is the first I've heard of it. So, so you're saying that anybody now with cancer, if you get a CT scan of their head, you will find an injury in their brain?
Yes.
And has this been shown or proven?
Yep, you see them all the time. A conventional radiologist is not trained to see these things.
But they're looking at these all day, right?
Yep. And sometimes you can see them.
Yeah.
Sometimes they do show up as brain tumors. A healing phase of one of these traumas.
So could they mistake them for brain metastases in some cases?
Yes.
They'll say, oh, it just spread to the brain. Whereas it wasn't. It was just a trauma from what you say.
Yep. Brain tumors are an interesting can of worms because, well, and Dr. Homer has never explained this, but some people will manifest more on the brain level. Those are the people who get brain tumors. And some people will manifest more on the body level. Those are the people without brain tumors. They have tumors or a physical disease in their body. But brain tumor patients usually don't have significant physical symptoms related to their brain tumor. They'll have the consequences, of brain swelling and these things that we of course expect to see with just a space-occupying lesion on the brain or something interfering with brain function. But when you look at the correlate of what the disease should have been for the location of the brain where their tumor is, they usually did not manifest that on a physical level in their body. So there seems to be some sort of tendency, which German medicine has never explained for me, or how to identify those people who manifests more in the brain, and is the person who will come up with a brain tumor versus those who manifest more in the body. Clearly more manifest on the body, just in terms of our rate, because everybody will wind up with some sort of brain tumor by the time they die. So
how would someone use German new medicine?
Mm-hmm.
Like, can you say this specific type of psychological pattern or trauma, I can predict which cancer you'll get? Or can you say you have this cancer, that means you've had this kind of trauma? Go get psychotherapy and resolve it, and the tumor might go away? Is that like how?
It can be. So the other massive piece of like the gift that German medicine gives us is the understanding of how the body processes disease. So every disease has two major phases. The active disease process, so the active phase, and the healing phase. So when a trauma happens, we get this unexpected shock that in the moment we couldn't deal with. We enter into a phase called the active phase that's dominated by the sympathetic tone of our nervous system. We're stressed. That is true disease state. 50% of cancers grow in that stage. The other 50% don't grow until we enter the healing phase.
Yeah, we know the immune system will be down in stress.
Correct.
So it is more conducive to forming cancers. But that we know, right?
Yeah, kind of. German medicine throws that out the window. But 50% of tumors will grow depending on the tissue. So will grow during that active phase. Those tumors need resolution of that psychological trauma to stop growing. They will not stop until we have psychological resolution of some sort. It can be a practical solution. Say we had a separation conflict. A person went away. We felt ripped apart from them. Person comes back. That's going to solve our trauma. And then there can be very and or need for psychological resolution when we can't have a practical solution like that. So sometimes it means changing our mind frame, changing our sets of expectations, understanding what the trauma was for us, becoming conscious of it in the first place, and then figuring out how to grapple with it. And we can use lots of different methods.
So that was my next question was, is it an event or a specific problem an event that you could reverse, or a problem that you could solve and give a solution to? Or is it a mind pattern that is something much more difficult to change, like a chronic persistent mind pattern that somebody carries with them for years?
Sometimes. We've usually had a setup trauma sometime in our youth. Sometimes before the age of 7, we've had our first trauma. That one isn't the one that will cause disease. It's the same trauma that happens in our adulthood that will then manifest in disease. So that's an interesting thing. People will have their tendencies. Yeah.
And you're saying it's the same trauma?
Yeah. Yeah, we've usually had one prior to the one that actually causes a physical manifestation of disease in our youth.
So you don't think it can be it's usually will just repeat what happened in childhood? Yeah, and well, it might not be the exact same situation, but the perception of the stress is the same. It's all in how we perceive that stress. And it's often because we have a certain set of expectations that we're rigid in. That's really the secret to disease resiliency, is not having expectations. Because when we expect a certain thing and a different thing happens is when we get shocked. That's the very definition of it. We're surprised by an outcome we did not expect. So if we have realistic expectations all the time and are flexible, that really is the biggest secret to disease prevention and resiliency. So we had active phase. So those active phase tumors need resolution of that stress to stop growing. So then we can swing into healing phase. Healing phase is dominated by the parasympathetic nervous system. That's our rest, digest, healing phase. And whereas we feel stressed, probably, and like go, 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 still in the active phase, which is the true disease state, healing phase is when we feel sick. We get tired, we do the work of repair then. And most people mistake the feeling of symptoms as being ill. But the truth is that that is actually when we are healing. And actually shifting that mind frame from being in that state of resistance, going like, oh, I'm sick and I don't want to be, feeling symptomatic, relaxing into that reality of, oh, okay, my body's doing the healing work. I need to just kind of relax into this, is kind of the secret sauce to making it go the easiest. It will speed up the healing phase, reduce the severity of symptoms, and kind of ease people through. But in that healing phase, so the other half of tumors don't grow until the healing phase. Breast cancer is a great example, actually. 2 major types of breast cancer, lobular or ductal. Ductal is by far more common. I think it's more than 80% of cases are ductal breast cancers. Lobular tissue and tumors grow in the active phase. Ductal tumors don't grow until the healing phase. And this is why the stats on breast cancer, especially found early or small tumors, are so good, because it's a healing phase tumor. If it was left bloody well alone, and we never knew it was there and we didn't do anything about it, it would finish on its own, be done, and never cause an ounce of harm to the person who has it. It's just breast tissue. It's a non-vital organ, doesn't interfere with any bodily function. The course of that tumor is in the first half of the healing phase. That ductal tissue grows back. In the active phase, there is actually microscopic ulceration in the ducts. So once we enter the healing phase, that tissue starts to repair and form tumor. So we actually get something noticeable. The second half of the healing phase, it depends if we have appropriate bugs in our system. The body can use bugs to break down that tissue. Or if we don't have the appropriate bugs, that tissue will simply caseate, kind of shrink into a scar.
And if it was found after that second phase of the healing phase, and it was biopsied, it'd be called benign. But if it got biopsied in that first half of the healing phase, it's going to get labeled cancerous. If it was biopsied in the active phase, it wouldn't get diagnosed.
Yeah, but I mean, you wouldn't be advocating for somebody who they found a ductal cancer breast to say leave it alone and it will be fine. So is that what you?
It totally depends on their psychological state for me. So that's where my responsibility as a doctor comes in, to evaluate where a person is at, where their psychology is at, and what is actually in their best interest. So someone who is totally afflicted with the fear of cancer in their diagnosis is not in the healthy, trusting state of their body to be able to take a purely German medicine approach. A German medicine purist would absolutely say that. Do not do conventional treatment. It is poison. All conventional treatment actually exacerbates the active phase. It puts you in sympathetic atonia, which can basically deepens the pathology, makes it harder to ever be able to repair, which we technically know of our conventional treatments anyway, right? The more we use them, the harder and harder it is to ever have the possibility of getting back to normal physiology, right? It makes us sicker and sicker and more resistant to therapy. But a German medicine purist would say that none of that is absolutely necessary. You just need to recognize your trauma, be able to deal with that, stay conscious, and you don't actually need any tools, a German medicine purist would say. I'm not a German medicine purist. Do I wholeheartedly believe in the information and trust it and see it play out in clinical practice every day? Yes, I do. But that doesn't mean that everyone is ready for it or capable of being confident in it. So sometimes it's a useful piece of information to help people trust that their body is capable than more than they think it is. And that's as good as it's useful for. And they still do all the conventional treatment. Sometimes we use that knowledge to most appropriately apply the timing of treatment. So for someone who's actively growing an active phase tumor, and maybe like growth is happening fast, they're not doing well, that's the best time to engage in conventional treatment because it's aligned with what the body's doing technically. It's not going against what the body's doing at that time. Someone in healing phase, sometimes it's a really terrible double-edged sword, and I've seen it play out a few times where kind of illy timed conventional treatment applied during a critical piece in the healing phase where the person was too fragile and they're never able to recover out of that cycle. So they were deep into the parasympathetic healing phase. Conventional treatment that pushed them right back into active phase was applied, and it kills them because it's going completely against what the body's trying to do at that moment. So sometimes I am able to coach people through, if they have a decent enough understanding and trust of that information, if they hear the story of German medicine and they go like, oh, that makes sense to me, like that resonates as true. Those are the people who I will then work with that with. If someone hears that and thinks like that's a load of hullabaloo, then you throw it out the window and you don't ever talk about it again. Because it's not useful and it will cause more fear and more doubt if you introduce ideas to people that don't make sense or resonate. So I learned that lesson early in practice, trying to give hope to a lung cancer patient who expected to die. She was young and vital and healthy, had a routine chest x-ray for another reason, found a tumor and told she was dying, even though she had been perfectly healthy. This is a classic German medicine story because lung tumors are often found that way. They had been active, who knows, a couple decades ago, and are now sitting there as a benign little lump in the lung, but found on routine scan and diagnosed at that point. Unfortunately, the trauma that goes with a lung tumor is a death fright. And so the diagnosis and prognosis of that lung tumor reignites that trauma in a huge way, and people rapidly spiral into this death fright, right? Their lung tumor patients are interesting. Like they're locked into this trance of and they quickly die.
You have specific types of traumas or mind patterns or psychological issues that go with specific types of tumors.
Precisely.
Can you give me some examples of that?
Yeah, so there's lung tissue responds to a death fright. And so biologically, the meaning there, the alveoli, that actual lung tissue, not bronchioles, responds to the fear of death by accumulating more tissue to take in more air. We need breath to live.
Oh.
That's the biological function, to be able to increase our oxygen receiving capacity.
So is this a form of self-fulfilling prophecy? They're afraid of death and they cause it by being afraid of death?
Well...
Or is it a specific discrete incident, like a fright of...
It is a fright.
Like a near-death experience or something, and then they become afraid of death after that. Is that what it is?
No, it would have been a shock. Well, and it can be in relation to a fear of yourself dying or a fear of someone you love dying. And that's actually the difference between, say, an individual lung tumor, one discrete tumor, versus often lung mets are speckled throughout the lungs. And that's the situation of when it's speckled throughout the lungs, that's fear of yourself dying versus a solitary lung tumor. But often they can be bronchial tumors as well. That's a different thing. That's a territorial anger conflict. Those ones are a little bit harder to explain, but actually it's not. We should talk about territorial anger conflicts because that is the same trauma. A bronchial tumor is the same trauma, just on a different magnitude as bronchitis. Our nice little COVID-19 coronavirus going around right now is a territorial anger conflict.
So I was going to ask you, how does German New Medicine then view these, for example, smoking? For example, inhalational injuries to the lungs, or as you said, a bronchitis of some sort, like that. Does it see that as, it's your mind pattern and these are just crutches that, or ways or means that your mind pattern, the body's using to create this outcome, but the outcome was predetermined by your mind pattern? Is that how they see it, or do they dismiss it, or do they not look at it at all? Or?
Kind of a German New Medicine purist would say it's always a psychological, like a conflict shock that causes disease, except in the rare circumstances where it's actually poisoning. You can cause
smoking on
disease.
Its own.
Smoking on its own would be really hard to completely poison yourself with. So that idea of like the little scratch that eventually causes a genetic disruption, no, they throw that out the window. But being acutely poisoned can cause illness.
Yeah.
And that's how you explain, the 110-year-old who's been a chain smoker for 90 years and they're still perfectly healthy, living their awesome life in the hills of Greece or whatever, versus another person who does smoke and seemingly have this increased risk of cancer. We also have interesting messaging around smoking causes cancer.
Yeah.
This instills a fear.
Well, I'll tell you a story. In first year of medical school, we had a class that was teaching us about alternative health systems.
Mm-hmm.
Now, they weren't actually teaching us. It was more of, you need to know, so that I know what Korean medicine means, for example, when a patient comes and says, I'm doing this.
Sure.
So it'll be like 1 hour each week, just about one thing.
Yeah.
And one of the weeks, and I remember it was very vivid in my mind, this native chief came in. And he talked to us for an hour or so about generally what they do to heal in their own practices and culture. And he was saying that how tobacco has a lot of healing properties, and he's saying, don't believe what they tell you that smoking causes cancer. It's not true. We've used it for hundreds of years, and it actually causes health.
Yeah.
And I remember we just looked at each other and were like, yeah, whatever.
Yeah, everyone laughed.
Sure, based on what? Like, you're just saying that. And so then, I don't know, years later I asked someone and they said, well, the tobacco they use is different from commercial cigarettes that we use.
Absolutely.
Which is the filters full of chemicals, so that could be part of what explains it. But from the German New Medicine perspective that you were just describing, it doesn't need to look at any of that. Is that right? It just looks at the mind pattern, regardless of what you do in terms of habits or lifestyle or genetics or anything.
Correct. And so there's...
Speaking of genetics,
yeah,
could it be that certain mind patterns are inherited, maybe, and that's why they're more common in one family or household than the other? Have you heard of such a thing?
These are definitely inherited, but I would say it's inherited. It's not genetic.
Okay.
So we get more esoteric there. But systems like Body Talk deals with that really well and calls it eighth chakra influences, where we can carry trauma patterns through generations. It's not encoded in our physical DNA in any way, but we can inherit these patterns. They can skip generations.
So you're talking now about something that is kind of at an energy level and not the physical level, right?
Oh, yes.
Something that you can't touch, test, feel, hear.
Absolutely.
Right? Okay.
Systems like...
And that's what German New Medicine says about genetics, is that right?
Yeah, genetics, schmanetics.
Okay.
Fooey, it says.
But they do look at inherited mind patterns, though.
Yeah, absolutely.
Which they think can occur independent of DNA.
Yes.
Interesting.
Mm-hmm.
Yeah. I mean, I guess when you were talking about how German New Medicine, and they would say, don't do these treatments, like don't do chemotherapy, do this instead. I guess those are types of examples where conventional medicine clashes with alternative medicine, and why it's labeled as, this is just dangerous, don't do that kind of thing.
Yeah.
So
there
I wonder,
is real danger in there.
Absolutely, but I wonder if in places where the two are a little bit more integrated, there's a sphere of alternative medicine, that there's a sliver of it that is accepted as, this is safe, it's congruent with what we're doing.
Yeah.
And maybe it's safer that way. Like the practice of alternative health over there is a bit safer. Because it's not this complete black box as far as medicine can tell. When I say medicine, I say, can you tell I'm biased? In conventional medicine.
Just perfect. Yeah. I don't know where my mind wants to go next on that.
Well, it's just that it just seems like this is a very wide universe of, I'm talking about alternative health now, in terms of practices, philosophies, treatments. They're all unregulated. They don't follow scientific criteria or have evidence backing them in the way that we would understand modern science to be, right? And so,
except naturopathic medicine, that is the one exception, that it is a regulated health profession, recognized.
Okay, so how is it regulated and by who? And can you tell me more about that?
Well,
so you're the president of the Provincial Association of Naturopathic Medicine, right?
Correct. Poised to become the college.
Okay.
So Saskatchewan is actually...
So that's a self-regulating authority, right?
Correct. Just like every other
medicine,
health regulatory authority. Yeah. So naturopathic medicine has actually had regulation in Saskatchewan for the longest. It was regulated since 1954, interestingly. And unfortunately, we still have that same legislation in place. New legislation was passed in 2015, and we're still working on getting the bylaws associated with that new legislation to pass royal assent so it comes into full effect. So that process can take a long little while, but hopefully in the next couple of years that will actually come through and basically update our scope and bring us into more modern structured legislation. That our old legislation is only a few pages long and basically says this naturopathic medicine and the practices were trained and says a few arbitrary things, but the modern legislation defines our scope more precisely and is inclusive of being able to order and access locally standard medical lab tests, prescribe medications, and it defines our invasive procedures, which we did not have before. So our ability to do certain invasive physical exams or certain invasive procedures like inserting needles that are regulated acts.
Sure, but now that exists kind of as a separate sphere then conventional medicine, right?
Yep, they're their own regulated health professions.
Okay, so at the current time, at least in Canada or in North America, I would dare say, there's no overlap between the two. Is that correct? Overlap in the way that they're actually delivered and practiced.
Correct.
Right? Okay.
Yeah.
Whereas
I think there's few and far between, probably individual examples of that. Yeah. There's maybe a few more in the States. For example, there is what's the cancer center in
where is it?
Oh, shame on me. That incorporates naturopathic care right into its model. It's like MD, Medicare. No, MD not MD Anderson. It's not that one. Cancer Centers of America.
Okay.
Cancer Centers of America have a team-based approach that includes like a dietitian and a mental health,
yes,
like your yoga, whatever, and a naturopath as part of every team.
Oh.
So it's an interesting integrated approach, but those naturopaths are also extremely limited in what they do.
Mm-hmm. Is that do you know if that's different from how it's done in Europe right now?
Well, my understanding in Europe is often that some of those alternative ideas are practiced right by the conventional docs. So it's right in hospital that you get prescribed your mistletoe.
So do you think any medical, like if somebody goes and like any medical student graduating from there, they would come out knowing some alternative health too in the way that they would practice it?
Yeah.
Wow, that is mind-blowing.
Yeah, in countries like Austria, Germany.
Because, I mean, increasingly over the years, we've had people go to medical school in Czech Republic, Ireland, and some other places. I haven't really heard of them doing anything like that.
It'd probably be more specifically Austria and Germany.
Just those two places,
yeah.
Right? Yeah. And I somehow got the impression Russia and Ukraine are way more advanced in terms of that integration.
Maybe, sometimes.
Yeah.
Not certain.
But we'd have to look into that.
Yeah. Yeah, I just don't have any firsthand examples there. But often the people doing interesting, completely alternative things there are medical doctors who are able to do it there without persecution. Right? Here, a medical doctor tries to do that sort of work, they quickly get shut down by their peers.
Yeah. Believe you me, I know. Yeah. All right. So I think the next time we meet, you will educate us a little bit on your perspective on coronavirus.
Yes.
We can talk about everything about coronavirus, what you think immunocompromised and cancer patients should do and how they should be behaving. Is this mass hysteria justified? What should we do and not do? And then we'll talk about maybe theories of where you think cancers come from. I think we touched on it, but we didn't delve deep. I told you my theory, but you didn't buy it, so let's hear yours.
Exactly, we can dive deeper.
All right, great.